Good afternoon. I'm Dr. Bonnie Henry, the Provincial Health Officer, and I'm here to give an update around some of the issues that we're dealing with here with the new coronavirus here in BC. And as you all know, this is a planned media briefing that we're going to do every Tuesday. And unintentionally, one of the first things I need to update you on is that we have identified a second case of someone who has tested positive for coronavirus here in British Columbia. This is a woman in her 50s who lives in the Vancouver Coastal Health region. She became ill a few days ago and was assessed in hospital, and the testing came back positive once again late last night. So Vancouver Coastal is working diligently today to get all of the details, starting last night and today, all of the details around this person. She has been in contact with family visitors from Wuhan and Hubei province. And she has a very small number of close contacts that are also being followed up with Vancouver Coastal today. So that is the main update that we have. This is not a surprise to us. We did expect, with all of the work that we're doing with public health, to monitor and assess people, and the low threshold that we have in the province to make sure that we test anybody that we have any concerns about. It shows us that our system is working and that we have lots of measures in place to protect people and to detect anybody early who has this infection. The second thing I want to talk about is just how important it is right now. We're watching globally what's happening around the world with this virus, and certainly in China. And I know you're aware the numbers of cases still continue to increase. We've been working very closely with our counterparts across the country and globally to make sure that we're doing everything we can to try and reduce the risk of transmission, and particularly the risk of transmission here in Canada and in BC. So we call on everybody to continue to take those measures. We are still, as I've mentioned before, we're still in influenza season here. We're seeing a lot of people ill, particularly young children, because we're seeing an influenza B season, which often affects young people. So there are many reasons why we all need to be extra vigilant, particularly in these next few weeks, when we're going to get a better sense of whether we're able to contain this virus. So those things, of course, are the important things of washing your hands regularly, covering your mouth when you cough, not touching your face and eyes and mouth, and if you are sick yourself, to stay home. And we want everybody to be aware of that and to be extra sensitive right now. But in particular, if you are somebody who has been in Hubei province within the last 2 weeks, it's really important right now that you take these measures to keep away from others and consider staying home, keeping your children home if you are still within that incubation period, and monitoring very carefully for symptoms and connecting with us in public health if you have any concerns at all about symptoms. We need to be extra sensitive about our children in particular, because they may not recognize if they have early onset of symptoms. And young, healthy people, we know with this coronavirus, young, healthy people may have very mild symptoms, but can still pass it on to other people. So right now, we want everybody to be especially careful about that, to monitor themselves, to monitor your children, and call us immediately if you have any concerns about infection, particularly people who have traveled. The other thing I wanted to update us on today, which was supposed to be the focus of our talk today, was the work that we're doing in partnership with our colleagues at the Public Health Agency and the Government of Canada around repatriation of Canadians who are coming back to Canada from Wuhan. We know that they are going to be in quarantine in Trenton. We also know that the plane will be refueling at YVR, hopefully, and the weather will allow that. And we are making preparations to make sure that we can support if anybody has medical issues that they need to be evacuated from the plane while they're here. We have plans in place to be able to support that as well. We also know that a good proportion or some proportion of the people on the plane will eventually come back to BC after their period of quarantine in Trenton. So we're working with our federal counterparts to make sure that we can support those people as well, both when they're in Trenton and when they come back here to British Columbia. These are the important things I wanted to update us on today, and I'm certainly willing to take questions. Maybe I can ask for
going around.
Okay.
Please wait for the mic before you speak, and identify yourself with your name and the outlet's name, please.
Hi there. Brenna Owen, Canadian Press. So just at the beginning, you mentioned, can you just reiterate who the second person has been in contact with? What are your communications with that person?
Right. So this is a person, a resident of Vancouver Coastal Health Authority, and she and her family had family visitors from Wuhan who are still here and living in the house. So Vancouver Coastal Health is in contact with all of them and getting all of the details. The work that we do in public health, making sure we are in contact with everybody that they've been in contact with, in close contact with in the last few days. So that work is ongoing.
And how are you determining, this is the second case, so for the first case, how are you determining, how this person and these folks can be kind of reintegrated once they're no longer ill?
Right, so there's a couple of things around that. That's a really important question. And it's a question that we've been watching internationally. How do we know when people are no longer infectious to others? And right now, the criteria that we're using is resolution of symptoms, so no more fever, no more cough, although sometimes you can have a little bit of a cough that may go on for some days. And right now, we're asking people to have 2 nasopharyngeal swabs 24 hours apart that are negative for the virus. And that's a way that we can tell that they're no longer shedding the virus in the respiratory secretions. So that's the protocol we're following right now, and that's what's been recommended by the WHO.
We'll finish with the questions on the floor first, and afterwards we will go to people on the phone. And when you're on the phone, please queue up by pressing *1.
Thank you.
Thank you.
So Frank Shi with Omni News. Apparently, this person have visitors from Wuhan. So is there any consideration maybe restricting people traveling from especially the epicenter Hubei province into Canada? Are you going to talk about that to public health agents in Canada? And the second question is, is the person who is visiting from Wuhan him or herself developed any symptom, and is he under testing or has he been tested?
So the first question, absolutely. We've been talking about this with the Public Health Agency and with the Government of Canada over the last few days or weeks. Both, all of us, we have, as you know, a special advisory committee nationally that includes myself and colleagues from across the country. So we've been looking at what's happening in China and what measures we need to take. The Government of Canada is responsible for travel advisories outside the country, and we are not restricting travel, although, as you're likely aware, there is quite extreme restrictions on travel from many cities within Hubei province. And we understand there's still a very small number of people from outside of those travel restrictions that come into Canada from Hubei. In the range of a few dozen people a day. Most of them do not come to BC, but some of them will. So those small number of people, we do want to be especially careful because we know that that's where the epicenter of this outbreak is happening. And so we encourage those people who have been in Hubei for the last little while to make sure they're monitoring yourself very carefully for any symptoms and consider staying away from others for the period of that incubation period of 14 days. If they have any symptoms at all, or if you have any concerns about your child having symptoms, please call us. So call 811, you can call your local public health unit, or you can call your local healthcare provider. In terms of, so the visitors are still here, and Vancouver Coastal Health is following up with the entire family and household right now.
And anyone else develop any symptoms or?
We don't have all the details yet, so those details will become apparent in the next little while.
So, Linda Ellsworth, Global News. You mentioned being prepared when people come back to China, from China to Ontario. So what is the plan if anyone falls ill on the flight as they're filling up in Vancouver?
For the repatriation
Yeah,
flight.
that's right.
So there's a couple of things. They will have Canadian Forces medical personnel on board the flight, and they have extensive plans for isolating people on the flight so that we're not in contact with each other, so you're not unintentionally exposing somebody if somebody does become ill. And they do have the ability to have a separate isolation area on the plane should somebody develop symptoms whilst they're in flight. If they touch down here and they need urgent medical care, so the only people that would be medevaced off the flight here in BC would be somebody who needs urgent medical care, either for coronavirus or more likely for some other medical condition that they needed assistance with. So we have plans for how to manage that.
But there would be a quarantine area here, I imagine, some sort of isolation if that was the case?
We would be putting them in through our health system with BC Emergency Health Services and the Richmond Hospital, and we have all of the protocols in place to ensure that that's done in a way that protects people from this coronavirus and other infections as well.
Just one other question. So the World Health Organization today declared this a pandemic. So by definition, what is that? But then also, what does that actually mean to us?
So a pandemic is an epidemic or an outbreak that has spread around the world and where you have transmission in more than one area around the world. The one we are most familiar with is an influenza pandemic, where a new strain of influenza can arise, as did in 2009, and can spread rapidly, in some cases, around the world. In this case, it technically would meet the definition because we've seen now upwards of 30 countries where there has been transmission and where there has been mostly limited person-to-person transmission in some other countries as well. This one still is very much focused on China, and the efforts that are being put in place to restrict and try and prevent transmission in China are really more extensive than we've seen ever, at least in modern history. Here in BC, it doesn't change anything for us. We are still definitely in our containment phase. We want to detect, assess, test, and be able to care for anybody who comes down with this here in British Columbia and prevent the transmission to others. So that's our focus, and that continues to be our focus.
Maria Weisgarber, CTV. Just to confirm, the second case is confirmed, it's not presumptive?
I should say that. It's a presumptive confirmed. It was positive at our lab here at BC CDC. And as you know, technically, for it to be called a confirmed case, it needs to be confirmed at the National Microbiology Lab. Samples have been sent there, and I fully expect they will come back positive as well.
Can you tell us anything more? I know you say that now the visitors of this patient are being monitored. So you're not sure at this point whether any of them may have been having any symptoms or anything like that when they came to visit, or?
Yeah, we assume that the transmission occurred, but the details are being undertaken even as we speak. This person was just identified quite late yesterday. Well, the test came back positive quite late yesterday, so Vancouver Coastal is doing the detailed investigations today, and we'll be ensure that we'll be testing. We'll also be making sure that they trace back any movements that these people have had and make sure we are in contact with everybody that may have had close contact with any of them. So we try to, when we do public health contact tracing, we tend to focus on the inner circle, the close contacts first, and then we move on to anybody who may have had more peripheral, and we do a risk assessment at each stage to look at what types of symptoms, how long did they spend. So it's very different if you're living in a household with somebody versus, walking your dog down the street every now and then. Initial understanding that we have is these people were well aware of what was going on. They left Wuhan before the travel restrictions were put in place, but they were also very conscious of the outbreak and were minimizing their contact with people outside the home. So that's our initial understanding, and more details will be coming.
Can I also ask, just with now, a second case being confirmed, and just the news around the world, is there anything you want to say to people to sort of alleviate some of the fears that are also surrounding this virus, and perhaps of some people feeling like, the moment that you decide to wear a mask or something like that, you're being singled out and people are afraid. Is there anything you want to say to sort of speak to those types of concerns?
Yeah, this case is not unexpected. It tells us that our system is working, that we're finding people, that we're assessing them safely in the hospital setting, for example. The things that we're doing every day to prevent transmission of influenza and the other bugs that we see this time of year are working. So people need to be really conscious about that, cleaning their hands, maintaining a distance. If you're not feeling well, even if you just feel like you might be fighting off something, it's okay right now. Right now in this next couple of weeks, with what all is going on, stay home, stay away from others, see if you can work from home, keep children away from school if you have concerns about them not feeling well. That's a good way for them to rest and help fight off viruses as well. So right now, I think it's good for all of us to be really conscious about this and to protect our children, to take those measures that we take to prevent infections and stay away from others if we're sick ourselves. And with this coronavirus, we know the epicenter is in Hubei province, and particularly Wuhan city. So if you're somebody who's traveled here from there, we ask you to be really conscious about that, to stay away from others, to avoid crowded areas, particularly because we know that early symptoms can be hard to detect, and that's an important way to prevent transmission of infection to others.
Is there any questions on the floor? Oh, one more here, please. Thank you.
Hi, I'm Eric with City News. I'm just wondering, so with the people getting the virus, like the 2 cases in Vancouver, so what are the treatment for them right now?
Yeah, there's no specific treatment for this virus, so there's no medication that we can give people. But most people, it's a respiratory infection, so it causes infections in the lungs and the upper airways and cough and sometimes pneumonia. Some people can get a secondary bacterial pneumonia, which antibiotics can help with, so we need to monitor them very carefully for that. And for some people, the viral infection, like influenza, coronavirus can exacerbate some of the other conditions we have, like heart disease or lung disease. So making sure they have what we call supportive treatment, making sure you have fluids, your other conditions are being managed appropriately, rest, and things to build your immune system so you can fight off the virus.
And we heard that in China, I think they have a few cases where they use the HIV medication to cure the virus. Is that true, or do you have any comment for that?
There are some trials ongoing with what we call antiviral medications. Some of them are ones that are used against another virus, like influenza, for example, and some of them are ones that have been effective against the HIV virus. But those are all clinical trials right now, and there's no evidence that any of them are specifically work against this virus yet. But that's a very important research area that's ongoing.
And just one more question. So are BC schools doing anything differently to make sure the kids are informed and aware of the virus? Because some of the parents are reporting that their kids are, afraid to go to school.
Yeah, I've been hearing that as well, that there's quite a lot of anxiety in young people because they're reading this and they don't know much about it. And as a matter of fact, I'm going to be talking to some young people about it. So we've been putting some messages together, and really for schools and for young people, the things that you do every day to try and prevent infections, washing your hands, really important things, and understanding what a virus is and how it works, those are things that we can do to help support our children. In the school system, they're looking at teaching children about hand hygiene and hand washing and covering your mouth and having a really low threshold for keeping children home right now if they're not feeling well, because that's the best way of protecting everybody.
So we'll take one last question. We'll go to the phone. Yeah.
Okay, on the phone we do have one question. This question is from Kevin Diaku from Pulse FM Radio. Please go ahead.
Hi, it's Kevin Diaku, Pulse FM. I'm just wondering what measures, extra measures, if any, are being taken to protect our workers at hospitals or first responders.
That is something that we're, of course, very concerned about. And from the very beginning, we've been working with our health authorities. I mentioned that we've established a coordinating committee, and we've ramped up what we call our health emergency response here so that we're coordinating around this. So there is messages around triage, around the personal protective equipment that one should wear, just-in-time training to remind people about wearing a mask, covering your eye protection, washing your hands regularly, and the things like if you are sick yourself and going into the system, wearing a mask when you go to the emergency department or your family doctor's office. So those are all things that we're working with healthcare workers across the province, in our facilities, in our communities, and also with the BC EHS. So yes, that is something that we started very early on, particularly recognizing that with other coronavirus infections like SARS and MERS, we know that there can be tremendously serious outbreaks that can happen in healthcare settings. I think it is reassuring to me in some ways that there's very few transmissions in healthcare settings in China, where this has been obviously the intensity of the transmission is immense, and we know that our healthcare workers here are well prepared.
Any other questions over the phone?
We do have indeed. This one is from Bob Mackin. Bob Mackin, if you can hear me, please go ahead.
Yes, hello. First of all, I've got a couple questions, but first of all, where is Minister Dix today?
Minister Dix has been fully informed and involved in this issue. He knows what's going on, and he is in Comox at the moment with the rest of Cabinet, and was trying to make it down here, but as you can see, it's been a challenging day for travel.
Okay. And I wanted to find out how many people from Wuhan are visiting this patient, and do these visitors have symptoms? Have you been able to determine whether whatever quantity this is of visitors have symptoms, or if this patient could have caught this somewhere else?
No, we are quite certain that it was family visitors that are staying in the household. It's a small number, and they are still here. And as I mentioned, Vancouver Coastal is working on the details with all of the close contacts today.
How small is a small number, and can you describe the makeup? Are these children, single people? What are we looking at here from this group of people in terms of quantity and makeup?
A small number is just that, and we're still getting the details, and I'm not going to be talking about those details at this point.
Okay, so now we will have one last question over the room here. Thanks.
Sorry, I just had to step out for a moment. So are you able to say how many, so there's 250 spots, I think, on this flight. Do you know how many people are going to be returning to BC after being in Trenton, and what that process is going to be like?
We don't know that yet, and much of the details, as we're hearing, will depend on who actually gets on the flight. There are many different stages they need to go through to get permission from the Chinese government to make it through the various checkpoints around their health issues. So we don't yet know that yet. We will know that once the manifest is complete, once people are on the flight, and we're working very closely with our federal partners to understand that. We will have a little bit of time once they arrive in Trenton to be able to facilitate things. We just preliminarily, it's probably, they estimate around a third of people have connections to BC.
Maria Weisgarber, CTV again. Could I ask, can we know how she's doing? How is the second patient doing?
Yeah, so she had symptoms that arose a few days ago, but she was assessed at a hospital, but is in isolation at home. So her condition is stable, and she's being actively monitored.
So this is the end of our Q&A session. Thank you very much.
Thank you very much. We're going to be releasing, as we mentioned, the numbers of tests that we've done on Friday, again this week, and we'll have a planned session again next Tuesday to update you. If anything else happens in the meantime, we'll be letting you know. Thank you.